Wound healing. Definition. Wound healing can be defined as the physiological process by which the body replaces and restores the function of damaged tissue. Types of wound healing. First, healing by primary intention. Second, healing by secondary intention. First, healing by primary intention. Healing by primary intention occurs in wounds which has the following characteristics. 1. Clean and uninfected. 2. Surgical incised. 3. Without much loss of cells and tissue. 4. Edges of wound are approximated by surgical sutures. Healing by primary intention is usually faster than by secondary intention. Primary intention occurs in 4 stages. First, hemostasis. Second, inflammation. Third, proliferation. Fourth, remodeling. Hemostasis. The action of platelets and cytokines forms a hematoma and causes vasoconstriction, limiting blood loss at the affected area. The close proximity of the wound edges allows for ease of clot formation and prevents infection by forming a scab. Second, inflammation. This occurs within 24 hours with the appearance of polymorphs from the margins of incision. By third day, polymorphs are replaced by macrophages. A cellular inflammatory response acts to remove any cell debris and pathogens present. Third, proliferation. Cytokines released by inflammatory cells drive the proliferation of the fibroblast and the formation of granulation tissue. Angiogenesis is promoted by the presence of growth mediators, example vascular endothelial cell growth factor, allowing for further maturation of the granulation tissue. The production of collagen by fibroblast allows for closure of the wound after around a week. Fourth, remodeling. Collagen fibers are deposited within the wound to provide strength in the region with the fibroblast subsequently undergoing apoptosis. The end result of healing by primary intention is a complete return to function with minimal scarring and loss of skin appendages. Surgical wound healing. Any wound made by a scalpel will heal by primary intention. Surgeons can aid healing by ensuring adequate apposition of the wound edges through use of surgical glue, sutures, or staples. Second, healing by secondary intention. Healing by secondary intention occurs in wounds which has the following characteristics. First, open with a large tissue defect at times infected. Second, having extensive loss of cells and tissues. And third, the wound is not approximated by surgical sutures but is left open. Therefore, healing must occur from the bottom of the wound upwards. It occurs in 4 stages as in primary intention. First, hemostasis. Second, inflammation. Third, proliferation. Fourth, remodeling. First, hemostasis. As a result of injury, the wound space is filled with blood and fibrin clot. Second, inflammation. There is an initial acute inflammatory response followed by appearance of macrophages which remove any cell debris and pathogens present. There is a larger amount of cell debris present and the inflammatory reactions tends to be more intense than in primary intention. Third, proliferation. Granulation tissue forms at the bottom of the wound. This is an important step as the epithelia can only proliferate and regenerate once granulation tissue fills the wound to the level of the virginal epithelium. Once the granulation tissue reaches this level, the epithelia can completely cover the wound. Fourth, remodeling. The inflammatory response begins to resolve and wound contraction can occur. Myofibroblasts are vital cells in secondary intention. They are modified smooth muscle cells that contain actin and myosin and act to contract the wound, decreasing the space between the dermal edges. They also can deposit collagen for scar healing. Complication of wound healing: infection, implantation cyst, pigmentation, deficient scar formation, incisional hernia, hyaloid formation, excessive contraction, neoplasia. Factors affecting wound healing. Two types of factors that affects the wound healing. First, those acting locally, and second, those acting in general. First, local factors like infection, poor blood supply, foreign bodies, exposure of ionizing radiation, all these local factors delays wound healing. Second, systemic factors like age, sex hormones, stress, diabetes, obesity, alcoholism and smoking, deficiency of protein, vitamin C and zinc. All these general factors delays wound healing.